Welcome to Healing Through Dentistry podcast,
where we redefine health, wellness, and the power of your smile.
We're your hosts,
Hannah
and Eva, twin sisters, qualified dentists and medical doctors.
This is more than a dental podcast.
It's a journey into profound connection between oral health and whole body healing.
Through personal stories, inspiring client transformations, and expert insights,
we explore how dentistry can ignite energy, relieve chronic pain, and transform lives.
Get ready to discover the extraordinary ways your smile can heal, inside and out.
Let's begin. Welcome to Healing Through Dentistry episode. This is again a solo episode. This is Eva speaking. So this episode, I would love to talk about a client who came this week. So it's a new client. It was a initial assessment for her, and I would like to talk about her because it's actually very fascinating. There's few points which I believe they could help many of you who are listening. And I will start why clients find our clinic. So it's basically two groups of clients. The first one is looking for answers because they are not able to find out solutions for their conditions, and they search for answers, and one of them which would come up is biological dentistry. And sometimes they see a documentary of root cause, which you can find on our website. It's in our library. There's few documentaries. First of them is Root Cause, which is a documentary about a guy who is actually a producer who produced this movie. It's very well done, so it's for all family. It's nicely done. It's about his story when he was struggling with his health and was leading him towards teeth. So this is one group of clients who are looking for answers, and the other group of clients who are optimizing health, and they're coming to look whether there is anything they would be able to optimize. So this is a lady who came to us last week, and she is having inflammation in her mouth, and she has been to the doctor with throat, and she went to infectious board. So she was exploring many areas of medicine. However, nothing is helping, and she searched for our clinic, and she came to us and asking whether there is anything we can help. We always sit with clients and we talk about their story. And I have to say that I am more and more asking later on questions, because they would stop there. This is kind of one thing they're dealing with. They have inflammation in their mouth and that's it. But we like to hear bigger story, the story which started when, and it's slowly coming up. In her case, her wisdom teeth, they were taken years ago when she was 19. She's now 48. She's living a happy life. She's doing supplementation, doing lifestyle. She has happy marriage, and she goes to Chinese medicine practitioners, and she's aware of health. However, nothing is helping to resolve her issues, which are painful blisters in her mouth, coming and going. So, and at the age of 19, she had the extractions of wisdom teeth. She is saying that she was 19, she wasn't really ready, she was very scared, and perhaps she wasn't really very calm on a dental chair, and she said that there was some remains in her jaw. And I think it's just the mind who is playing in, because it's not about if you are calm on the dental chair or not. Sometimes it's very difficult to remove wisdom teeth. So the most important thing is that the body is not ready within the nutrients, so we don't have building stones to build up the bone structure. So we oftentimes remain with non-healed areas, uncovered socket residues, which are then later on inhibited by pathogens, bacteria, viruses, parasites, and they are circulating in our body and doing the harm. So I'm saying this for these sites, I'm saying in the story first, because also she said, and she almost forgot to notice it, that years ago she had eye surgeries, and then she also has kind of spot which is running in her eye, and she's not dealing with that. The ophthalmologist said it's because she's getting older. But we know that the eyes are on the meridian of the heart, and it's the area of the wisdom teeth. So I always explain to clients that we don't know what will happen after the surgery. However, the body is so beautifully smart and it's all so connected. So we are seeing many times changes in eye visions when we do the surgeries where the wisdom teeth were before. And she has a root retained there as well. So we will see what happens after the surgery. And she also said that her stomach is not well, and the digestive system as well. But also what was important, and I'm leading towards the dead teeth. She has 2 root canal treated teeth. One of them is from the age of 14, which is more than 30 years, in her mouth, which is a dead tissue in her body. And what was fascinating is that when she had the root canal treated done when she was 14, she remembers that she had a huge acne after that on her face, and nobody from the family was suffering from that before. So they were treating her with a month course of antibiotics, and then again a month of antibiotics. So which is, for me, the information we hear a lot. You know, some people are really, really sensitive to microbiome and aggressive toxins. They develop the skin reaction very quickly. And, you know, once the root canal treated teeth are removed, the skin heals. So this is fascinating to know what was going on 30 years ago. Then, you know, the immunity, the body is super smart, is trying to secure us. And basically we are so good that the body is so good that it's trying to solve everything. But the root treated tooth is there, the source of the bacteria which are causing the issues are still there. The tooth on examinations is very dark. On X-ray, according to Western medicine, the dentist would say that it's looking good. However, we know from the data and from the researches is that it's not only the abscess, the hyperdense area, which is alarming, but it's also the hyperdensity, which is basically the dead bone structure around the tooth. And lots of my colleagues would say that it looks good and nothing shouldn't be causing any problems. This is on her meridian, lower intestine meridian, and the other second root canal treated teeth also. This is a lung and large intestine meridian also, so both of them. So the other thing which is interesting is that she said she's drinking a lot of kombucha, and I recommended to have a little break from that and try also to go, you know, anti-inflammatory foods, gluten-free, dairy-free, and, you know, perhaps for 14 days, so you know how you feel when you start eating that again. She said that she tried that before also, so it helped a little bit, and then, you know, she had the flare-ups in her mouth again. You know, in perspective of kombucha, I would say we just decided to have a break from kombucha for a while. She still eats sauerkraut fermented, which is done. She has the homemade one, which is amazing. But kombucha is really creating the microbiome, which may be a little bit more aggressive, which we will maybe talk about later on in the next episode with Hannah. And the second thing we decided to do is to rinse with salt water many times a day, to alkaline the background, to just favor for the good bacteria and for like the bad ones to go. And also to choose different toothpaste don't talk about toothpaste that much on a podcast because we kind of assume that the audience knows about fluoride. I would repeat, no fluoride toothpaste is neurotoxic, and also there's ingredients which are sulfates, and they're like kind of chemicals which are harming us. She is using chlorhexidine toothpaste for years with a good intention, which is always the case, but chlorhexidine is destroying all the microbiome. So she's basically would not have any bacteria, any good bacteria, any kind of colony of microbiome there. So we will see what we will see in future. But saying that, if you do not remove the source of the bacteria, of the pathogens, then, you could be optimizing everything as much as you want, but still, the source is there, which is, from the age of 14, the root canal treated tooth. And she also asked other dentists to remove the tooth, and they were not willing to, because they said the root canal treated tooth is good. It doesn't need to be removed. So I really encourage everybody to follow intuition and search for information. So there is a group of biological dentists around the world, so search for answers there. And I am sharing the stories here also because I feel that it's important for people to know and to hear personal stories in order to see, to correlate and to see whether they could benefit from that too. One more thing we were talking about also is non-toxic household, which means that, you start really using shampoos and soaps and everything you clean your kitchen with in a biological and eco way, because that's also a big load for the body to fight with, to protect. And we were also talking about cold plunges because she was going to traditional Chinese medicine practitioner. She was doing Wim Hof or cold plunges in nature for 4 years, and she always said that the coldness the soreness in her mouth would get worse afterwards. I would say towards that, we should follow our intuition, especially women, and do things how we feel, not what, they say it's good for you. I know that traditional Chinese medicine is not in favor to cold plunges, especially for women. But I say I wouldn't just exclude it totally. I would say that the soreness in her mouth is connected with the immunity, with the microbiome, with the balance of her body, and the body is really disbalanced with the fact that there is chronic inflammation. So I would summarize. The client has 2 root canal treated teeth, which are on large intestine lung meridian, then also cavitations or covered socket residuums where the wisdom teeth were, also 1 residuum of the root which remained after the extraction. And the symptoms or the signs she is experiencing during her life were the acne, which was severe before, then eye surgery, eyesight issues, and then digestion, little issues, and soreness in her stomach and soreness in her mouth. So let's see what would the clearing of the inflammation would lead to. And in her case, it was just the first session we had this week, but slowly you kind of feel that we could start with the quadrant and we could have a look on that root canal treated tooth she intuitively wants to have removed, which is her molar on the right side. And also on the right side, there's also the root retained after the wisdom teeth extractions, and plus there's residuum, covered socket residuum, the cavitation. So we would just clean that, and we will see whether we will be able to place the implant immediately, zirconia implant, and then we will go from there. I love when clients lead the journey, and I love when we also have a plan, like a goal for future. So I like to point out all what could be done, which is like kind of big plan. But then I love our clients to be the leaders of their health and life and feel what it's the best for them. So I wanted to share this initial story with audience for them to know why people are looking for biological dentistry all around the world and what could we resolve by removing the really dead tissues, inflammatory tissues, which are hidden in our jaws. So I can't wait for this to be continued in future. So take care and looking forward to a next episode.
Thank you for joining us on Healing Through Dentistry podcast. We hope today's conversation has inspired you to see your smile as the gateway to whole body well-being.
To stay connected, visit us on our website or follow us on social media.
If you enjoyed this episode, please subscribe, leave a review, and share it with someone who could benefit.
Until next time, remember, healing starts with a smile.
Take care,
and we will see you in the next episode.